Well, I've been a pharmacist for about 20 years. I'm also a pharmacy owner. Our network, PharmacyBC.com, has 6 medicine shop locations. And we're running Healthtab at 5 of them. These were the first pharmacies in all of Canada to offer this system, so we're very proud of that. Our scope of practice is expanding, and I think that this trend will continue. At the same time, the population is aging, chronic diseases are on the rise, and so this is putting a lot of pressure on our healthcare system. So I think pharmacists will start to play a bigger role in patient care beyond just filling prescriptions. And you can see this already in a number of new services that we're starting to provide. So we are now doing flu shots, immunizations, and as well now the point of care testing. Our pharmacies are very forward thinking. We're always looking for new technologies and services to help us stand out. For example, we came across the INSTI HIV screening test back in 2013, and we're the first pharmacy in Canada to also offer that point of care test. So when we saw Healthtab, we realized the INSTI was just the beginning. Well, Healthtab is a lab-accurate screening system designed specifically for pharmacies. It'll allow patients to measure up to 21 key biomarkers from a finger prick blood sample. So we can measure things such as cholesterol, triglycerides, blood sugar, liver and kidney function, and electrolytes. And these are numbers that we all need for preventing and managing chronic diseases such as heart disease or type 2 diabetes. It's pretty simple, actually. Patients, they log in from a touchscreen kiosk that sits on the counter. Then it basically flips over and becomes the operator console. And in our pharmacies, we have private consultation areas where the pharmacist collects a few drops of blood from a finger prick. And so patients who don't like needles are finding this a lot less intimidating than they would at the lab. The pharmacist then dispenses the blood into a small reagent disc. They'll place it in the analyzer like you would a CD and presses a button. And that's it. About 12 minutes later, the analysis is complete. Well, as soon as the results are ready, the patient gets an email. When they log into the system, they get this simple dashboard view. And the results, they're color-coded by risk, so it's easy to focus on areas that might need attention. And you can also learn more about the tests and track results to see if they're moving in the right direction with their health. As well, with the patient's permission, we can print their Healthtab right in the store, and many of our patients choose to do this. This gives our pharmacists a consultation opportunity, basically to pass on healthy living tips and address any concerns. We then suggest that they also follow up with their doctor. We see Healthtab as a way to deepen the relationship with our existing customers and also to attract some new ones as well. For example, we've been using Healthtab alongside the Med Review to provide patients with a more in-depth assessment of their health. And I think this is going to have a huge effect on compliance of treatment as well. We've also just partnered with the Kidney Foundation of Canada for a government-funded community screening initiative. And the goal of this is to help identify chronic kidney disease in its earlier stages by reporting the eGFR score, which the Healthtab allows us to do. So I have no doubt that this is the future of our business. It's an exciting time for the pharmacy industry, and it's really an exciting time to be a pharmacist right now.